I was pleased with the last meeting. You know, we got the majority of the votes, 4 out of 5, 80%. I was very pleased with that. I think if all the board members had been there, I think we would have gotten our CON. So we're looking forward to our project, and the HFSRB reviewing our project again. So we're ready. I guess I don't really see it as a war. There's a lot of things that we work on together jointly. We have the Cancer Treatment Center we work on jointly, and we have a good working relationship with Belleville Memorial. I see Mr. Turner often, and we speak, and you know, we are definitely competitors as well, and we believe that there's enough business. There's enough need for healthcare in our region that we can both, you know, we've been here on this site, very close to Belleville, downtown Belleville Memorial, and we're only moving 7 miles away, so we're not really changing too much in the world of healthcare as far as where we're placed. 7 miles apart is really is all. And you know, we are committed to Belleville. We are keeping Belleville. We're keeping outpatient services here, which are we're keeping physicians here. We're keeping laboratory services here, radiology services, including mammography. We're leaving business office functions here. So we are still leaving St. Elizabeth's Belleville here, and we will still be close to Belleville. So no, I don't really see it as a fight. I think the media is trying to make it more of a fight than it really is. We don't believe it's a duplication of services at all. And I think this is a really important point. Belleville Memorial East is a satellite facility. That's what they call it in their certificate of need. If you read their application, their certificate of need application, it's a satellite facility. It will not do high risk, services, and anything high risk will actually be transferred to Belleville Memorial down in Belleville. And so they won't do cardiovascular surgery, they won't do neurosurgery, they won't do high risk OB services. So we're replacing our hospital. We're totally replacing it. The relationship between the satellite facility and Belleville Memorial is similar to our relationship with our community hospitals, meaning St. Joseph's Breeze and St. Joseph's Highland. Those are great community hospitals. When they have very sick patients, they transfer those patients to us. So that's the difference. They're not even, you can't compare them to each other. So they're different types of facilities. I'll tell you that the sisters have been, their ministry has been here for 140 years. Our mission is to reveal and embody Christ's healing love for all people through our high-quality Franciscan healthcare ministry. That's just not true that we're leaving because for a better payer mix. In fact, 75% of our patients do not come from Belleville. 75% of our patients do not come from Belleville. So when we replace our hospital 7 miles away, our payer mix does not change. We have a study out on the HFSRB site by Deloitte that shows that our payer mix, there's a study out there that shows our payer mix does not change. In fact, the only change that they see is an actual increase in Medicaid patients, which are patients that don't have, that are poor or lower income. And our move actually places us closer to 8 out of the 10 most poverty-stricken areas in our region. So there's no truth to the fact that that the sisters are leaving their mission or their ministry. I think that there's a strong sense of emotion around us leaving, and I think a few Belleville residents expressed that nostalgia, and I think that those emotions and nostalgia will be replaced once our regional medical center, they see our regional high-quality regional medical center on 64. You know, I always ask, do you know why this hospital's here? And people don't really know, and it's because of the railroad. We have railroad tracks here, and that used to be the major mode of transportation. Used to be railroad. Supplies, people, equipment came by the railroad. Well, it's not that way anymore. It's actually the highway. And so for us to build a new regional medical center, it makes more sense for that to be on the highway as well. And I think that it will be a gem for all of the region, including Belleville and all of the people that we care for and will continue to care for the next 140 years. Yeah, so if the board, we're hopeful that the board members will be present and they'll approve our CON, and then we start building our hospital. So the exciting part Your question about what happens, we have a year to try again if they don't, I guess if they don't if they don't approve the hospital. There was four scenarios that the hospital looked at, that the sisters and our administration, myself, looked at over the last 5 years. We've really been discerning on whether to build this hospital and to provide a regional medical center for the last 5 years. And it was to rebuild this hospital, to rebuild it or or remodel it. That was number 2. And really, we're on 17 acres of land here, so we're landlocked. Our new land is 116 acres, so it's over 110 acres for the future. The other option was to close down and not have a ministry here any longer. And the fourth option, which we chose, was to build on a green site, a greenfield site. And that's what we've chosen, and that's what our plans are. And we're looking forward to the future and the next 140 years for our ministry.